Hi, it's Dr. Josh here, and I just completed an amazing interview with Dr. Peter Rogers, MD. This is actually the first time I've invited someone back to a podcast here at Alzheimer's Breakthrough, and he did an amazing job summarizing what in the world is autoimmune disease and how you can diagnose it and treat it. And the reason this is relevant is that many cases of Alzheimer's have an autoimmune component. But even if you don't have Alzheimer's, you're not going to want to miss this episode with Dr. Peter Rogers on autoimmune disease. Peace and plants. Dr. Peter Rogers is a Stanford and Harvard-educated physician renowned for his expertise in optimizing human performance across academics, athletics, and health. With over 30 years of medical practice, he has distinguished himself in neuroradiology, interventional radiology, completing fellowships at both Harvard and Rush University Medical Center. Initially recruited to Stanford University as a varsity wrestler under Olympic champions Mark and David Schultz, Dr. Rogers transitioned from athletics to academics following an injury. He earned the Student Athlete of the Year award and achieved top 1% scores on his medical board exams. That means he's smart. Dr. Rogers is a vocal advocate for a whole food, low-fat, plant-based diet, often referring to it as the Spartan vegan diet. He emphasizes its role in preventing and reversing chronic diseases such as atherosclerosis, diabetes, and cognitive decline. His personal health transformation, losing over 50 pounds and overcoming fatigue, fuels his commitment to lifestyle medicine. This is Dr. Josh again, and this is a first for my podcast, Reversing Alzheimer's. I have a return guest. Dr. Peter Rogers did such an amazing job the first time. We are having him back, and we're going to specifically discuss, and I'm going to ask him about autoimmune diseases. And the connection here is one of the many root causes of Alzheimer's turns out to be autoimmune diseases, autoimmune components. And obviously, each case of Alzheimer's is going to have a different amount of autoimmune component, but without further ado, Dr. Rogers, thank you so much for joining us again. And first of all, how would you define autoimmune disease?
Well, autoimmune disease is basically when the body attacks itself. And so it's a loss of self-tolerance, if you will. And the immune system's confused for some reason, so it's damaging itself, the body.
Right. And that makes sense. One thing I find challenging discussing this is you just mentioned the immune system. We are constantly learning more things about the immune system. And as we learn about new components of the immune system, we're finding that sometimes diseases are involved. Does autoimmune disease seem like a black and white type process, or are there many shades of gray?
Yeah, it's like the same thing in med school. The medical school textbooks, they're all a joke. They're ridiculous. They're comical, because they always do the same thing for all the chronic Western diseases. Well, nobody really knows what causes it, but you might as well buy our drug and try to slow it down. I go, gee, thanks, that's really helpful. And by the way, we've got a lot of expensive testing. So, whereas, once you start learning about nutrition and plants and all this stuff, and you learn about leaky gut and how leaky gut can be quite often prevented to a large extent by eating a high fiber diet, it's like you got a chance to cure it. And, what's his name? Dr. Walter Kempner, one of the greatest doctors of all time, he noticed he was curing all these psoriasis patients just, inadvertently while he was feeding them a low-fat diet of rice and fruits.
It's interesting. I noticed this exact same thing when I worked at True North for a few years, is that we would put patients who had autoimmune diseases on a water fast. And while they were just drinking water from, say, between 10 days and 40 days, their autoimmune disease would go away, whether it was psoriasis or whatever it was. The key issue was when we started refeeding them. if we refed them too quickly or on certain high inflammatory foods, they would be more likely to redevelop their autoimmune condition. So my question to you is, do you think it's just the gut? You mentioned leaky gut. Do you think it's just the gut that's responsible for autoimmune, or is it more complicated?
Well, I think most of it comes from leaky gut. I think that's the dominant issue. And it's really a question of bacteria and bacteria toxins, endotoxins getting into the blood. And when you have leaky gut, what's basically happening is you've opened up your border and all these bacterial toxins are getting in and your immune system goes crazy and it starts causing inflammation all over the place. So that's the big picture. But you can also get bacterial toxins if you have poor teeth, periodontitis. So that's another mechanism. But then, some patients don't get better once you fix the leaky gut, the tooth problem, the dental problem. So you got to look for other things. I've read a bit about substitution mechanisms whereby you can have a chemical. I think glyphosate is a big thing doing this. So glyphosate is like we talked about this a little bit before, Roundup, and it's essentially sort of like a glycine phosphate. There's an extra nitrogen on there, but you can essentially think of it as a glycine with a phosphate. Glycine is the smallest amino acid. This has a hydrogen side chain, but now you stuck a phosphate on there, making it big, bulky, and charged. Well, it's thought that lady Stephanie Seneff writes a lot about this. She wrote an interesting book
from MIT, yeah.
Yeah, Toxic Legacy. I thought that was an interesting book. Real pleasant reading, a small print biochemistry book with no pictures. Okay. But that's a mechanism, and especially with collagen. Collagen's about 1/3 of the proteins in our body, and every third amino acid in collagen is a glycine. And she believes that the glyphosate is substituting for those glycines and distorting the shape of the collagen. And I actually think I have a reason to believe she might be right.
So wait, is she saying that the glyphosate is actually getting incorporated into the collagen?
Yes, that's what she claims.
Interesting.
Yeah, she claims that it's a substitution for glycine. And she says that's also why it damages a lot of enzymes, because glycine's commonly in the pocket, in the active site of the enzyme, and it's that small side chain that allows the substrates to fit into the enzyme. And she says now you stick this bulky phosphate in there, and both its charge and its size will repel the substrates quite often, and you got a dysfunctional enzyme. So that's kind of interesting.
That is fascinating. And the way it was marketed is, sure, the glyphosate is going to kill all these, weeds and things, but don't worry, it doesn't hurt human cells. And I understand that, but the problem is, my understanding is it destroys your microbiome. It destroys, yeah.
It was an antibiotic is how it was first marketed.
Right.
The thing is, it's toxic, man. It wipes out your microbiome, and it causes a lot of other trouble too. But I'll tell you what I think is going on, though. I got something interesting for you. I kind of figured out degeneration of the spine. It's a long story. I wrote a book about it called Ischemic Spine is the Most Common Cause of Back Pain. And what I'm getting at is I had noticed since I was a resident, I see more and more and more dish of the lumbar thoracic cervical spine, diffuse idiopathic skeletal hyperostosis. And I'm like, gee, every patient has dish. It's almost like until proven otherwise, they got dish. And so what that means is you got these bridging bony spurs, osteophytes, and they'll go all the way from the pelvis up to the skull. And I remember back when I was a resident in the 1990s, and we'd look at the book and it would say something like, dish is a rare condition seen most often in Asians, probably genetic, but nobody really knows. I'm like, bullshit. I see it every single patient. Okay, so then I started asking myself why. And I sort of think I figured it out. Primarily ischemic. You got a disc between two vertebrae. And when the disc becomes ischemic, the outer part is the annulus fibrosus, like a steel-belted radial tire, central nucleus pulposus, like a jelly donut, radial tire cracks. Then you can herniate the nucleus pulposus. It dries out, you lose height, disc desiccation. Now you get a little abnormal motion in the VBs. The spine's important job is protect the spinal cord and the nerve roots. And so it's got a lot of proprioceptors. It senses that abnormal motion. 2 VBs in a disc is a segment. Okay, so you get segmental instability. It goes, uh-oh. And then, the old saying, the hedgehog is only one trick, but it's the best trick. The hedgehog plays dead. But what the spine does, it lays down bone to ossify and fuse the segment. So it'll fuse the segment. Once the segment's fused, now the adjacent segment gets accelerated degeneration because it has to bear more stress. So it fails, and the process marches its way all the way up from skull to sacrum. Okay, so I see that, but I go, why is it increasing in incidence? Of course, I see a calcified abdominal aorta, thoracic aorta. The spine is ischemic from that. You get more atherosclerosis on a posterior wall. But then I also said, well, it's worse than that. Now we know you could get it from fluoride. Skeletal fluorosis can look similar. And that actually damages collagen as well. It substitutes for the hydrogen.
Right. And just to be clear, humans are now getting much more exposure to fluoride because it's it's now added to our water supply. It's in certain vaccines. It's in lots of different places.
Yeah, and then also though, so now we got screwed up collagen from ischemia, screwed up collagen from fluoride, but then we got glyphosate on top of it, and that I think it has increased more than the other factors. The other factors they were there in the 1990s to a large extent, and so I think that's contributing to the increased incidence. That's my speculation, and so that's damaging the collagen, weakening it, so it's increasing the frequency of segmental instability, I think, and then maybe also you can be a vitamin C deficiency from people don't eat enough fruits, for example.
Sure. So let me ask you this, because what's commonly marketed out there is, oh, you're worried about your collagen? What I'm going to do is I'm going to sell you collagen from cow meat or other animals. And, the theory is if you eat collagen in your diet or in the supplement, somehow that's going to fix the collagen in your body.
I don't think so.
Yeah, I don't think so either, but I bring that up because that is a common marketing tactic that I see out there.
Yeah, under normal conditions, only, an isolated amino acid, a dipeptide or tripeptide can be absorbed under normal conditions. So
right.
It's absorbing that small of a thing. How's that going to find its way to your collagen?
Right. Collagen molecules are huge, and just eating something that's huge normally is not going to get absorbed. So going back to the common causes of autoimmune disease, your theory, not just your theory, but one of the common theories out there is it could be from a leaky gut. So let's talk more about leaky gut. I don't know about you, but when I studied at Harvard, the term leaky gut, that wasn't on our curriculum back then.
Yeah, nothing that's clinically useful finds its way in the medical student textbooks. It's true. That sounds like a joke, but it's true.
Right.
Yeah.
Right. But third spacing we definitely learned about third spacing.
I heard a little bit about third spacing. Yeah. But I can actually write all the chapters for internal medicine textbook, medical student pathology textbook on chronic diseases. Well, it's associated with aging. Sometimes it's genetic. It might sometimes be associated with an infection, perhaps a virus. There does seem to be some association with socioeconomic disparity. It's like, oh, gee, isn't that thoughtful? Isn't that well-written? It's a bunch of bullshit, okay? We talked about this before. You get the Kenyans, the blacks in Africa where they eat a plant-based diet. They don't have any hypertension, and they're as poor as it gets, okay? These are diseases of diet and toxicology primarily. Okay.
Right. And I see that in the real world. If you fast, if all you do is give someone water to drink for 3 weeks, all these autoimmune problems go away. And it makes sense that, if all you're doing is drinking water, you're not feeding the bacteria or other processes in the gut.
Yeah, exactly. The gut has a chance to heal when you're not putting harmful food stores.
That is wild. Okay. So
it's like the blood pressure. The blood pressure comes down too because it's caused by the food as well.
Awesome. So let's talk more about leaky gut. So my understanding, one of the things that causes leaky gut is not having enough fiber in your diet. Is that your understanding too?
Yes. The dietary fiber goes, into the colon, and the good bacteria, they take that fiber and they convert it to short chain fatty acids. In particular, the butyrate, 4-carbon butyrate, and that's used by the enterocytes, guts the enteric tract, and it's used by the enterocytes to make tight junctions. And that maintains the gut barrier, so bad stuff like bacteria and their toxins don't get into the blood.
That's exactly right. So I've also been taught, and actually by you, not just a substance called LPS, but also LTA, that the cell wall membranes from bacteria can also cause this leaky gut. Is that true?
Yeah, they can get in there. So a couple of things. Basically, if you don't eat enough dietary fiber, you get bad bacteria. And the way I see it is that the good gut bacteria are our friends. They're symbiotic with us. Our colon is a good apartment for them. They want us to be healthy. It's a win-win thing. I think we've co-evolved with them for who knows how many hundreds of thousands or whatever years. Okay, so we give them fiber, and they're like, here you go. They hand off short-chain fatty acids with the butyrate in particular, maintains the gut barrier, and everything is good and healthy. But when you don't have the dietary fiber, then you don't have those good gut bacteria. You get a different type of bacteria. And those bacteria, the meat-eating, processed food-eating bacteria, they don't care if we live or die. And they're quite happy to just eat through our intestinal wall. And they will, eat through the mucus. They also generate more hydrogen sulfide. I think it's because they're typically come in the context of a high-fat diet. Usually a low-fiber diet is a high-fat diet. And you get more bile, you get more taurine-type bile acids. They convert that to hydrogen sulfide. That changes the pH in the gut, and it actually induces apoptosis of some of the enterocytes, which also leads to leaky gut.
But it's not just taurine. There are other amino acids that have sulfur, like methionine, right?
Yeah, well, methionine, is an important amino acid, like in the meat. But what I'm getting at is once you drop the fiber, you'll typically also be adding the meat and the processed food, and you get these aggressive bacteria that participate in eroding through the gut wall. And they also, once the LPS gets behind the line, so to speak, deep to the gut wall, it damages the goblet cells, so you secrete less mucus, and you start getting this vicious cycle of the leaky gut tending to get worse. So the wise move is, eat a lot more fiber.
Right. And some people are going to listen to this and say, you know what? I don't really like eating fruits and vegetables. Let me just go get some Metamucil or some over-the-counter fiber supplement. What do you think about that?
I don't think that's a good idea. It's better to have the fiber intrinsic to the food stuff and let your body naturally work at separating it from the food. That gives you a more gradual absorption of your foods. For example, it's good to eat fruits and starches. Those keep you healthy, and that prevents leaky gut. There's a couple other things to watch out for, though. Processed food has a lot of chemicals in it. For example, the emulsifiers, and those also have a tendency to contribute to causing leaky gut. Carrageenan increases the risk of it. Cooking oils, those omega-6 cooking oils with fried food, increase the risk of leaky gut.
Wow. So tell us more about, my understanding is that the average American maybe gets 15 grams of fiber a day, and we're designed to get, I think, over 100 grams of fiber a day. Do you still agree with that?
Yeah. And that's similar to Dennis Burkitt.
Right.
Okay. Yeah. And they say that we should get a minimum, an adult man of at least 50 grams a day. But yeah, the average American, I've heard 5 to 15. So they're not getting much. And then on top of it, they're getting all this bad stuff, the processed food. Then they're drinking the tap water with the fluoride, the aluminum, the chlorine. All of those things damage the gut bacteria and increase the leaky gut. So they got a lot of things working against them, plus aspirin, nonsteroidal anti-inflammatories, alcohol. It's multiple things quite often damaging that gut. So, it's good to know all this so they can avoid it, give the gut a chance to heal.
Right. So what's interesting, what gets marketed to the public, in my opinion, often are what are called prebiotics. So instead of saying, take my fiber supplement, take my prebiotic supplement. So again, I think we're both on the same page. Instead of taking a prebiotic fiber supplement, just eat foods that actually have fiber in them. Agreed?
Yeah. I think it's funny because if you say fiber, then it sounds mundane, but you say my prebiotic, figure out how to say it in French. That'll be for sale.
Unbelievable. Okay. So, and then you also mentioned, importantly, there are many toxins that were around, including fluoride, that can actually do damage to our gut and then lead to leaky gut. And then for someone like me who tries to work with and reverse Alzheimer's, I normally see an association between a leaky gut and a leaky brain. And I'm curious, as an interventional radiologist, are you doing any studies to specifically look at gut health?
I wish I was, but I tried looking around all the research institutes. It's hard to find anybody that's kind of like serious about the way I think. It's almost like all the big research institutes, they want to try to sell something and make money, whereas I don't know how to sell anything. Anyways, getting back to the brain though, in the gut, when you get the butyrate, it not only helps the gut lining cells, the enterocytes, to make tight junctions. It enters the blood and it travels to the brain, and it's used by the endothelial cells of the blood-brain barrier to make their tight junctions. So that's why leaky gut and leaky blood-brain barrier go hand in hand. And it's highly relevant because you got leaky gut, for example, and that means you have increased amounts of the bacterial endotoxins coming into your blood. Well, now you've got leaky blood-brain barrier simultaneously. So those bacterial endotoxins, LPS from the gram-negatives, LTA from the gram-positive bacteria, they've got ability to get across that leaky blood-brain barrier and cause some irritation of your brain, the meninges and the outer surface of the brain a little bit. So you got guard cells in the brain called microglia. They're the residential macrophages. You can call them sentinel macrophages. And they will bind to the LPS, for example. It'll bind to toll-like receptor number 4, and they'll go, the immune system works by Braille. It just feels everything. So it goes, we've got a problem here. Bacterial toxin, incoming bacterial invasion, clear the area, prepare to sterilize, and they release all these toxic chemicals. Okay. And, you got normal brain cells, normal meningeal cells, that's the brain covering in that area. They get collateral damage by this. So it's not good for the brain.
Right. If we could go back a little bit, let's go back to gram-positive and gram-negative bacteria. Obviously, one source is going to be inside our own gut, that our normal microbiome. But I think another source is if you're eating animal products, that there's often endotoxin, and I'm assuming LTA also from if you're eating meats or other animal products like that. Is that true?
There was something along those lines. I think it was Dr. Greger had a good video about it, that the endotoxins were getting into the blood too fast, and it couldn't have been from the colon after eating the food. It had to be happening, I think, from the small bowel. So that was one example of an indicator that these were coming from the meat itself. Plus, the way I think of it, too, is a bacteria that attacks meat, an animal, is more likely to attack us, rather than something that, feeds off of plants is not going to be as likely to be able to adapt to feeding off of us.
But let's take that one step further. My understanding, and let me see if you agree with me, is this whole concept of molecular mimicry, that there are certain molecules in animals that are a little bit different than our own molecules, whether it's galectin. Some people will get allergic to galectin after eating meat. So my question is, how much is molecular mimicry part of autoimmune disease?
Yeah, I think it's a real big part of it. I don't know the exact percentage of it, but the gist of that is, as I mentioned earlier, you can only absorb mono, di, or tripeptide under normal conditions. You get leaky gut, big chunks of animal protein can get across those gaps in the gut wall. And then they come now in the subepithelial level, below the enterocytes, and the immune system reacts to them. And the immune system, again, it goes around by Braille and it feels it and it says, this does not belong here. Self, non-self. This is non-self. We must remove it. Okay, form antibody. Antibody comes in like a little fork and it binds to it. And the antibody binds to it, but then it'll sometimes cross-react with our own body. I mean, basically, you say, like, what is a hot dog? A hot dog is like you throw an animal in a blender, okay, and then you put a covering on it and you eat it. So let's say, for example, there's a little piece of thyroid in there from the animal. The antibody could form to that piece of thyroid. It's a piece of thyroid like this. I don't know if I can try to make some people can see. And then it might be, so it's different enough that it's recognized as non-self by the immune system, but it's similar enough that it might cross-react with our own thyroid. So molecular mimicry is a sequence of amino acids in the protein that we've ingested being similar to our own, but auto means to go against self. So autoantibody cross-reactivity means it attacks ourselves. So that's the leaky gut mechanism of autoimmune disease.
Fascinating. And just as an explanation, and when people are raising animals to harvest them for food, they're normally not raising them under sterile conditions. And I think that's one of the things. That's where a lot of these bacteria are introduced. Is these other animals have their own intestinal system, which has tons of bacteria, and on the surface of their skin too.
Yeah. I've also heard, like in a slaughterhouse, the animals will have feces on them, and so that will be something that, you eat. You can cook it to some extent, but you can't cook away the endotoxins. That's my understanding.
Right. And another practice in industrial food production is apparently right before they harvest cows and other animals, they'll feed them plastic bullets to basically clean out their GI tract, which you'd be like, great, there's not as much bacteria there. But instead of the bacteria, you've got all these plastic bullets. You've got these plastics that end up getting absorbed into the meat when it gets harvested. So, and you're making faces. I've looked, there aren't a lot of information about this online. I think this is an industry practice that they've kind of hidden from the public, but that's my understanding, is that they intentionally have these animals eat these plastic bullets. But let's talk about plastics and other toxins, what impact those could have on the gut.
Yeah, well, I do know there's been some papers come out recently, like one was in Nature about finding microplastics in the brains of humans at autopsy and in the kidneys and some other organ systems. So that's pretty scary. It's not exactly clear yet where they're predominantly coming from, but it's certainly a worrisome thing. And it's like, how do you avoid that?
Yeah, well, I mean, one way is don't eat animal products. You're not going to get exposed to the plastic bullets that way. But
Yeah, also don't ever heat anything up in a microwave in a plastic container.
right,
And nobody knew that years ago. People
right.
heat up a baby bottle in plastic in the microwave. Nobody knew that years ago. So
Or the people who did know about it weren't sharing that information.
it wasn't widely known information.
Right.
So you live and you learn.
Yeah, it's scary. So tell us more about. So going back to what I learned decades ago about leaky gut, the equivalent would have been sepsis. So if you've got a very sick patient in the intensive care unit, that they're in a septic state where basically you've got bacteria traveling uncontrollably throughout the whole system, the whole body, including the gut. But I think what we're talking about here is you don't have to be an end stage septic patient about to die. You could. What I find interesting is that there are degrees. So you could have a leaky gut and a leaky brain, but still, sure, you might have some anxiety, some increased brain inflammation, but you're still walking and talking. You're not one of these patients we would try to take care of who was having trouble keeping their heart going and breathing, etc.
Yeah. This is very mild in compared with sepsis, but it's a chronic, ongoing, injury to the body. And so the good news is leaky gut is fixable. Once you understand all the stuff we're talking about here, avoid the things that hurt the gut, do the things that help the gut, eat the starch foods, eat the fruits, and that'll help protect your gut. And then take good care of your teeth so you don't get the periodontitis, how that can cause it. And then you've actually won the battle against the majority of autoimmune disease, but there's a couple other things too we haven't gotten to yet.
Right. And let's not go there yet, but let me ask you this, because specifically if you're watching either social media or if you're getting your information from the popular press, one of the popular diets out there is a ketogenic diet where you're just eating tons of fat and frankly avoiding fiber. What we're discussing here makes perfect sense. It aligns with what the research shows, but that's not what's being presented to the general public. How do you account for that huge disparity?
Well, basically, I sometimes call the general public the pros. Okay. And if the pros had their act together, it would have a giant effect on the economy. Okay. So I believe that on the internet, a lot of time, effort, and money is put into keeping the pros confused. Okay. Because, I think that when you look at it, big business looks at the pros kind of like livestock. Okay. Let's just be honest. That's how it's seen. And so, for example, I'm 61 years old. I'm a low fat, low sodium, 100% vegan. Okay. I don't have any medical problems. I don't take any pills. On the other hand, if everybody was healthy, the medical system would lose money. The drug companies would lose money. All these obesity, everything would lose money in the healthcare system. So you got to keep them fat, sick, and stupid. And the way you do that is get them to eat these high fat, high meat diets. Paleo, keto, carnivore, low carb is all nonsense. There is no science behind it. It's just a way to keep the pros confused. And one of the things to see their commenters is they always have a bunch of troll type commenters that make these sort of aggressive, emotional statements. You'd even call it like rage bait instead of clickbait. And they're always trying to say, oh, well, what kind of a doctor are you? Or you're an idiot that you don't recognize, we're made to eat high fat. Our brain's made out of fat. Don't we need to eat fat to make our brains? All kinds of this sort of stuff. And, I really, if you go through it, I one time did some lectures on the effect on blood flow, the effect on cancer. Meat dramatically in like over 20 different ways, 30 different ways, increases your risk of atherosclerosis and cancer, earlier death, and all the long-term studies on these high-fat, meat-based diets. They always die sooner with more cardiovascular disease, hypertension, diabetes, and obesity.
Agreed. All right. So I diverted you there. You were going to talk about 2 or 3 other angles on autoimmune disease.
Yeah, there's a couple other things, and I think that some of them are kind of interesting. One of them is the idea of inhaled chemicals. It turns out if you inhale a volatile organic chemical, something with a high vapor pressure at room temperature, quite often something that smells bad, those chemicals, sometimes your lung will have a hard time clearing them, and they'll cause some scar tissue and inflammation in the lungs, and that can lead to autoimmune diseases. There's an association of that with scleroderma. There's an association of that with rheumatoid arthritis. And I don't know how common it is, but it's just one more thing to be aware of. And what could you do? Well, don't live next to a factory and avoid things that smell bad, which means like paints and glues. Don't go to the dry cleaner. Okay. I don't go to the dry cleaner. I just do my own shirts. Okay. And it works out just fine. They're not as perfectly, they got more wrinkles than they would otherwise, but that's better.
Right. But let me pause right there, Dr. Rogers, because I've had patients with autoimmune conditions with Alzheimer's who, when I check, have very high levels of those chemicals, and they don't work at a dry cleaners. I think the likely source in many of these is their drinking water. Yeah, and that's why I strongly recommend people either drink double distilled or distilled water or reverse osmosis. That unfortunately, a lot of these chemicals, sure, you don't want to live right next door to a chemical plant, but unfortunately, many of these chemicals have now leaked into the municipal water supplies.
Yeah, I think you're totally right. The water is a big source of toxic stuff. There's tons of chemicals. The lakes and the oceans are like a sewer, and everything goes there. And then what I've heard is it's too expensive for the water filtration companies to carbon filter it. So all these toxic carbon chemicals in there, besides the fluoride, the chloride, and the aluminum. And the aluminum causes leaky gut as well. So you've got toxic chemicals plus leaky gut, increasing their access to the blood. I think it's good to have a whole house carbon filter. And it's good to have, like, for convenience, I like a reverse osmosis filter underneath the kitchen sink. You can put fluoride filters on, twist them on in your shower area if you've got fluoridated water.
Awesome. And then there is hope if you have accumulated a lot of these fatty toxins in your brain and other fatty tissues, there's specific things that you can do to remove those toxins, whether it's total plasma exchange, EBU. I use IV glutathione and IV phosphatidylcholine. Just understand that there are actually ways to get that out of your system. It's just a lot easier to keep it from getting in the first place. The problem is once these fatty toxins get in, some of them, like the PCBs, forever chemicals, might have a half-life of 30 years in the body. So unless you're actively doing something to try to get rid of them, they're still going to be around.
Yeah, and eating a low-fat diet, you minimize your intake of these fat storage chemicals. A lot of them are stored in fat.
100%. All right, so that was one angle. It sounded like there was a couple others that you wanted to go over too.
Those are some of the big things. And I think, like I said, a lot of those chemicals, they smell bad. The paints, the glues, the liquid papers, all that stuff tends to be associated with some of these cleaning chemicals, varnishes, waxes for making new furniture and shining it. All that stuff tends to be toxic. Like one of the worst things you could do is work in a nail polish salon. You don't want to even walk in one of those places.
100%. And sometimes when I'm working on detoxifying these people, another technique we do in conjunction are actually colonics. And you can actually smell, during the colonic, they can actually smell the specific chemicals they're trying to get out of their system. So unfortunately, it's the real deal.
Yeah, I think it's good to live simple, kind of like Adam and Eve, but keep your indoor heating and plumbing.
That is so true. How about, you're experienced as a radiologist. What about some of the heavy metals? I know gadolinium is used sometimes for
gadolinium gets used too much because it's convenient. Like you talk to a neurologist, here's what a neurologist is going to tell you. These patients, it's so difficult to get them to show up into your office. we might only have one conversation with them to try to figure out what's going on. So we want them to get the IV contrast before they come in. And that's actually a reasonable argument. But here's where it starts to break down. A lot of patients are chronically followed up for different conditions. They might have a benign tumor in their brain called a meningioma, and they come back once a year to get a follow-up, or they'll have a tumor in their internal auditory canal where their hearing system is, an acoustic schwannoma, vestibular schwannoma, same thing. And they'll give contrast every year, or they'll be followed up for ventriculoperitoneal shunts, for example. And they're giving them contrast too often. Usually they don't give them for VP shunts, but still, these patients keep getting contrast, and they shouldn't. Well, if you got a big macroscopic finding, you could see it. You don't need contrast because that gadolinium, we see it accumulating in the brain. So we see it in the basal ganglia. We see it in the dentate nuclei of the cerebellum. And it's like the more they get, the more likely it starts accumulating. And also people get followed up for the sella turcica. I think the pituitary gets imaged way too much. Like you'll have guys come in, hypogonadism, high prolactin, pituitary cell MRI. And then there's a lot of times normal variants, these small micro cysts that are non-functional, and a lot of people normally have them. They're normal variants. And so when you start imaging, though, the radiologist, they said the definition of a radiologist is a weasel beneath a hedge eating a waffle. We're all scared, what the heck? What if that's a small tumor or microadenoma? So we always say possible microadenoma. Then the guy comes back every year for follow-up, and they give him IV contrast, and he ends up getting tons of gadolinium, and so that's a bad situation. What I would recommend is do as few MRIs as you can, see what you can figure out from the blood, and follow up without the IV contrast because, you usually don't need it. If the tumor's really grown, you'll see it.
Right. And often what I'll say is, do the MRI first without the gadolinium, and then, if you still need it, then do it. But often the reason this comes up is I'm looking at heavy metal tests, blood and urine for my patients with autoimmune conditions, Alzheimer's, etc. And they'll have, for example, high levels of gadolinium or technetium, or, and then I'm like, where in the world did you get exposed? Oh, yeah, I had a lot of contrast or these nuclear studies. It's kind of crazy.
Yeah. And I'm smiling too, because you made me think of a book. There's an interesting book called, I forget the name. It's something about mercury. The author's name is Jane Hightower. She was an internal medicine doctor out in San Francisco area. And she had all these yuppies becoming demented. And they go, well, gee, this is kind of strange. These health conscious yuppies are becoming demented. And nobody quite knew what to do with them. They tested them for different things. Nobody could figure out what was wrong with them. And the gist of it was they were testing the wrong way for mercury. And it turned out these were yuppies who were eating more and more fish because they had heard that fish makes you healthy.
Right. Fish is good for you. Yes.
Yeah. They all had mercury toxicity off the charts. And she got them to stop eating all the fish. And she, instead of calling it brain fog, she called it fish fog. And she said a lot of them completely recovered, but some of them didn't. Some of them had permanent brain damage from eating fish.
Right. And I see that very commonly, especially if someone has a low white blood count, because often the mercury and other heavy metals will suppress people's immune system, their white blood cells, which in turn, so if I see a low white blood count, I'll say, do you eat a lot of fish? They do. And then we do test heavy metals. And it's not just mercury, it's cadmium, arsenic, all these other crazy heavy metals.
Yeah, there was an interesting lady. Her website's called Lead Safe Mama. And 2 of her children had gotten lead toxicity when the painter told them they could stay in the house while they were painting, and they removed the old lead paint. So it's a disaster. Her kids had brain damage from it. So she's very upset about that, of course. And she devoted her life to testing all these different things for lead and other things. Well, the reason I bring it up is you had mentioned cadmium, which is an intermitochondrial membrane inhibitor. And what she said is cadmium is more likely. She said, you got to watch out for pastas. The more that they design it into some ornate shape, a curly Q, a spiral, whatever the heck they do. She says the more they mess around with it to shape it into something, the more likely it's got cadmium in it from the machines that shape it into that.
Oh, wow. There's actually cadmium or other heavy metals in those machines.
Yeah. So that made me a little bit hesitant to eat pasta, because my girlfriend's like, well, why don't you have some pasta? I'm like, well, I'm not that big a fan of pasta. Well, this is the best pasta. I'm like, well, I don't, so let's say you want to get the one with the fancy noodle. No, I don't want the fancy noodle.
All right. So let's talk about what to do. So someone's hearing this, they've got an autoimmune condition. Great. So they're going to listen to us. They're going to eat lots of foods with lots of fiber. fruits, vegetables, whole grains. Let's say that doesn't work. What about next things? And I definitely want to cover the Schwenk diet and Brooke Goldner. I mean, there's specific diets that are out there that are anti-inflammatory diets that actually work. So I wanted to get your opinion on that.
Yeah. You just sort of step down one path. So the first step would be like Roy Swank. Roy Swank was a neurologist, MD, PhD from Harvard. Then he was working in Canada. Later on, he ended up in Oregon, and he's got 34-year follow-up or more on MS patients with the best results of anyone in the world by far. If they were diagnosed early.
Right. I mean, the data were if you got diagnosed early, there was a 95% chance that your MS would basically go away, stay in remission forever.
Yeah, so I thought that was great. He had the best results. What's funny is even the modern neurologists, they all ignore the guy. He's not in any of the books. The typical scenario, all the nutrition pioneers are ignored by conventional textbooks.
Right. But let's be clear. I've offered that type of diet to someone with newly diagnosed MS, and they'd be like, Dr. Josh, wait, you mean I have to give up meat? I can't eat my favorite foods? I don't care. Give me MS. I'd rather have MS. I mean, I think that's crazy, but I understand. Yeah.
Yeah. I have patients, they say, well, I'd rather die than stop eating meat. I'm like, well, that's exactly what's going to happen. They don't get it. The proper attitude is, this is all I got to do, God, is eat these plant foods and I don't have to suffer these terrible diseases. Thank you. I'll do it. I'll do it.
Well, but let's be clear. It's a real addiction. When I cut out meat, I mean, I went through withdrawal. This was a dozen years ago. I went through withdrawal headaches for a couple of weeks. I mean, it's a real process for many people to get off of this stuff.
Yeah, well, I think the average person doesn't understand sickness and disease. All day long, I see disaster train wrecks, and I'm like, I don't want to end up like that. The average person my age in the United States is fat, sick, and stupid. I don't want that to happen, so I'm going to do the best I can to avoid it. So a couple things, though. So the big thing that Roy Swank emphasized was to minimize saturated fat. He felt that saturated fat was the biggest contributor to blood sludge, the biggest contributor he felt to causing hypoxia within the tissues. He measured up to, I believe, 30% drop in oxygen delivery in the hamster brain after feeding it a high-fat diet. And he did a whole bunch of these studies showing the red blood cells being clumped together by the chylomicrons, and they're also clumped together by triglycerides and by LDL cholesterol. Call it blood sludge.
Right, sludge blood. And you can see it, right, if you feed someone a fatty meal and draw their blood 10 minutes later, you actually see it layering out in the test tube.
Yeah. So it's you don't want to be doing that. And he got tremendously good results with that. The other thing we hadn't really got into much yet, and it's a little bit of a sidetrack, but it's still in the same ballpark, was the idea of celiac disease as well as non-celiac gluten sensitivity. And so basically the gliadin protein can be irritating the gut lining. Some people are especially sensitive to it. And Stephanie Seneff comes up again too. And Stephanie Seneff says, look, it's increasing in frequency too fast to be genetic. Something's happened to the food. And she believes it's the glyphosate sprayed on those foods is making them more irritating and causing, like, it's tripled in incidence, I think, in the last 15 years. And she believes that it's because the glyphosate is making the food more irritating. There's more to it than that. The BT corn, Bacillus thuringiens corn, that intrinsically is designed to pop an insect's stomach. So not a big surprise. It irritates our gut wall.
Wow. And and I found it really ironic that in order historically to test someone for gluten sensitivity, they tell them, all right, go off of all gluten. And then after they stop eating gluten, then we're going to test you to see if you have antibodies against it. I mean, the whole thing didn't make any sense where, we're going to take away the irritating component and then, oh, look, you're not allergic to gluten, whereas unfortunately the reverse is true. Most people are sensitive to gluten in terms of changing your immune system.
Yeah, so one can avoid the things that have high levels of gluten in it, or that I would recommend avoid everything sprayed with glyphosate. They do stuff like before the harvest, especially like in Canada, I've heard, if it's not organic, if it's organic, they're not allowed to spray glyphosate on it. But if it isn't organic, they can spray it on oats and beans. Apparently it makes the leaves come off and then they can harvest the part they want, the seeds, the beans,
right.
etc.
It makes it easier to harvest, but unfortunately it also, that means if you're spraying right at the harvest time, you're also increasing the concentration if you or I or someone else eats it.
Yeah, so I only eat organic food. I don't eat anything non-organic.
Right. And I've often heard from people that, wheat from the United States, they react to, but if they go to Europe, for whatever reason, the way that wheat is raised there, they don't have the same reactions.
Yeah, I've heard that it's quite a bit genetically modified. There's a guy by the name of Voidani. Voidani has the father who's about, I don't know, 76 or something years old, and he was a big pioneer in testing for autoantibodies. And then the son's name is Elroy Voidani, and he's got some YouTube lectures, and they are pretty knowledgeable, but they say some things that I think are ridiculous. They recommend, these meats and stuff, and I'm like, I think that's insane. I mean, it goes against everything I know about the gut. And I'm also going to say something too. I've seen about a lot of patients. This is something that patients don't seem to understand. Conventional medicine doesn't either. You don't cure a disease by taking a picture of it. Everybody loves, I'm going to go for another blood test. I'm going to go for a CAT scan, an MRI, an ultrasound, test after test after test after test, and all these follow testing. Why don't you try fixing the diet and see if you get better? That's what'll cure you. If anything, it cures you.
Right. And I agree with you. But again, if you're addicted to salt, oil, sugar, fats, and you take it away, your body, your brain, our brains are actually trained to want more of it. So you basically have to educate yourself or be educated that you are probably going to go through a period of withdrawal.
Yeah. I understand that as well. But what I don't understand, what I'm trying to say is, in my experience, patients are not afraid of disease and testing and, et cetera, et cetera. But they, like you said, they freak out when you tell them you got to change your diet. And I'm like, well, dude, you got to do something to get better. We can take 1 million pictures of it. I can send you for 1 million CAT scans, 1 million MRIs, 1 million blood tests. You're not going to get better unless you change something about your diet and your toxin exposure. And that's your chance to get better. And you might as well start doing it ASAP, because the more time goes by, people develop irreversible damage. And then, it's harder to get a good long-term outcome.
I agree with you. But let's talk about what people are often offered by their conventional rheumatologist or, whoever they're going to. They're normally going to be offered what we call the DMARDs, disease-modifying antibodies. And I'm scared of those because if you ever look at the warnings, it's like, may cause death, may cause, don't take this if you have an infection like tuberculosis, because then your immune system will not be able to fight the tuberculosis. Yeah, what say you?
Yeah, they're almost like chemotherapy. That would be the absolute last thing I would do. I mean, maybe if the autoimmune disease is really bad, that's what you got to try. But there's a whole bunch of steps. Number 1, fix the diet, eat more fiber, avoid all the toxins. Okay. Number 2, you could even try those elimination diets. Avoid the common allergen things, the corn, the soy, the gluten, the dairy, for example. See how that goes. And then there's other things less commonly, onions, radishes, grains, beans, lectins, a few other things. Try all that. See if that works for you. You can try a fast. You can try, like, you guys at True North, go on the fast and see if that gets you better. And then gradually reintroduce some relatively safe type foods and see if that gets you better. That's all reasonable. You could try testing for all the weird things that Voidani's lab tests for. Fine. All those autoantibodies. Fine. But then if you still ain't better after that, and you also avoided the chemical exposures we spoke about, the volatile organic chemicals and that sort of thing, and you're not, you got the water filter and all that, I would say your next step would be, try like the Brooke Goldener, high omega-3 diet and suppress your immune system in a reasonable way, and that might get you better. That's a reasonable thing to do. I would definitely try that before I would go down that path of those DMARD chemotherapy-like drugs.
Awesome. Yeah, I agree with you 100%. What about in terms of, it seems like most of that women are much more likely to get these autoimmune diseases than men. Why do you think that is?
Well, a couple things. Their estrogen is thought to increase the activity of the immune system. And it's like women are a little less likely to get colds and some of these minor infections. They tend to fight that off better than men. But more ramped up immune system might also be more vulnerable to autoimmune disease. Yeah, like you said, they get 80% of autoimmune disease. So I think that's relevant to it. I've seen a picture in some journal article about the estrogen ramping up the immune system, the testosterone suppressing it a little bit.
Agreed. I've seen that too. And originally, so Alzheimer's, 2/3 of Alzheimer's cases are in women. And the original theory behind that was, well, that's because women live longer than men. They live long enough to get these diseases. unfortunately, that's not the explanation. Sure, women may live a little bit longer, but not to account 2/3 of the cases. So another component is obviously women, if they're pregnant, during pregnancy they're exposed to potentially, to other antigens that could trigger autoimmune. Do you think
Yeah,
that's a large component?
yeah. Having a baby is almost like having a transplant. You got foreign tissue in your body that they have to suppress their immune system not to react to it during the pregnancy. So that might have something to do with it. And then also, I think they're exposed to, like we talked about earlier, all these estrogenic chemicals. And maybe they're more sensitive to them than a man. They're in personal care products, they're in food, and all that stuff. Oh, another thing I didn't mention too is like in clothing. Clothing, I would never buy a shirt that says no ironing necessary, because that usually means there's formaldehyde in it to stiffen it.
Oh, wow.
Yeah, that's a pretty
Yeah,
toxic.
yeah, formaldehyde. I remember when we in medical school in anatomy, the corpses were pickled in formaldehyde. So, yuck.
Yeah, yeah. I'm also kind of laughing too because you talked about the DMARDs, the drug modifying medicines, and they're so powerful. They damage and suppress the immune system too much. Okay. And I kind of smiled the other day because it just popped into my mind this thought. It reminded me of that old thing, like it's a little bit like chemotherapy for cancer. You need your immune system to remove the cancer cells. So you're going to give chemo to wipe out your immune system. And that reminded me of like the Vietnam War. In order to save the village, we had to destroy the village. And you're like, what the hell is that? I would rather save the village. Okay. If there's something I could do first, I'm going to try everything possible. And, if that doesn't work, then maybe got to go to DMARD, but that would be my last resort. If I was really having bad complications from the autoimmune disease and I tried everything, including the Brooks Goldner, and that didn't work, then I would be willing to consider it, but not until then.
That makes perfect sense because of the side effects. I mean, it is warfare. I've got a couple quick true false questions for you. True or false? Allergies and autoimmune disease share similar mechanisms involving gut permeability.
Well, I do think that that's part of it because the immune system gets access to the chemical when it gets across that gut barrier. So if you have an intact gut barrier, you're less likely. And I have seen people get better from celiac sensitivities when they started eating healthy. I've seen people get better from asthma when they started eating healthier. My brother was a fantastic athlete, state champion, freestyle Greco-Roman wrestling in high school, went to college. Everybody expected him to be a national champion or All-American, and he didn't. He just didn't have the energy in the third period. Guys like the Iowa guys would wear him out, beat him. And so then he became a vegetarian in his 40s, and his endurance went up off the charts, and he started winning all these international competitions and stuff. So what I'm trying to say is he had exercise asthma, probably from the high dietary sodium, leaky gut from his crappy diet. And it went away and his endurance came back. A lot of people get more energy when they eat these plant-based diets. So I thought that was interesting. So you can get better. And yes, it's part of a related mechanism. It gets a little complicated if you're talking about IgE, IgM, and all this stuff.
Awesome. And then the next question, true or false? Most autoimmune diseases can be prevented or reversed with diet and lifestyle alone.
That does usually seem to be the case. But when you say diet and lifestyle, it means doing things like you just referred to earlier. You got to get that water filter or you'll be ingesting all these toxins. That's essential. So we're going to include that in the lifestyle. And I would say, yeah, if you avoid the toxins, you eat the healthy diet, the majority of patients get better. I one time heard Stephen Esser give a lecture about autoimmune disease. He's a pretty bright guy, and he's got a lot of experience in plant-based feeding-based. And he said in his experience, 85% of patients get better when you fix the diet and lifestyle stuff like we talked about. And then you got a remaining 15%, depending on how you define the categories, where you got to start trying all these other things. And that sounds about right from other things I've read and heard.
Awesome. We've covered so many different parts of autoimmune disease. I feel like we could talk another hour. Is there anything I didn't ask that I should have?
I forgot one thing that I think is kind of interesting. Is the idea of NETosis. NETosis means when a neutrophils are the most common white blood cell in the blood. They're about 65% of white blood cells. And they are the first responders. They travel around in the blood and they just wait for a problem to happen and they go try to fix it. Okay. So one of the things they do is they'll come to a spot where, let's say, they think there's a possible bacterial infection. They'll release some chemicals like MPO, myeloperoxidase. They'll try to phagocytize the bacteria, get around it and eat it, so to speak. But if they can't fully get around it or the bacteria is adherent to something, they then have this crazy maneuver where they open up their plasma membrane. It's like opening up their guts, and they throw their DNA on top of the bacteria like a fisherman's net. And the DNA is decondensed. Okay, it's citrulline such that the histones no longer stick. Histones are like a spool of thread to wrap the DNA around, and they make them negatively charged, so they repel the DNA. And now the DNA is thrown out over the bacterial site. Sometimes it'll be over damaged tissue as well. And when it's thrown out there, all of a sudden, what you've done is kind of like Seneca, the Roman senator who opened up his guts. Okay, and they throw it out. It's like a fisherman's net. And what I'm getting at is it's very prothrombotic. I think it can contribute, in part to increased blood pressure, but it also
blood pressure and clotting too, right?
And clotting, yeah, it's prothrombotic. And there's another interesting thing about it. I remember in med school having to memorize autoantibodies. Lupus can be diagnosed by anti-DNA double antibody,
right.
Also anti-cardiolipin antibody, and rheumatoid arthritis with anti-citrulline protein antibody. And so what I'm trying to say is, where the heck did that all come from? And I think a lot of it comes from NETosis, because you're getting these intracellular chemicals that are now exposed to the extracellular space, and that would not normally occur. But with this NETosis means NET, neutrophil extracellular trap, because it's throwing their DNA out like a fisherman's net. That's the extracellular trap.
And when it does that, I'm assuming the neutrophil is dead, right? If you throw out your, you can regenerate cells, but if you throw out your DNA, that's not coming back.
Yeah, the neutrophil's dead. It's vital NETosis is when it dies right away, and then there's vital NETosis when it takes a little while to die, but regular NETosis it dies immediately. Yeah, it's sort of a crazy, insane thing. But excessive saturated fat diets and leaky gut contribute to increased NETosis, and that, I believe, increases your risk. There's a lot of papers on this stuff. Increases your risk of autoimmune disease, but you get back to the same thing. Eat the healthy diet, and you're less likely to ever end up with this activation of neutrophils and all this NETosis stuff.
Yeah, this has been amazing, Dr. Rogers. Remind us, where can people find you if they want to watch more videos of you? Yes.
Oh, yeah. I have a YouTube channel. It's called Peter Rogers, MD. I make a lot of videos about stuff. I find all this stuff quite interesting. I also have written a bunch of books, like probably my most recent book, kind of interesting, is Food, Mood, and IQ. And I've also written books. Probably my best book would be Medical Reformation. And that's about all these body diseases. Anyways, not many people read nowadays. And so that's how I started making videos, because no one reads.
Well, but I'm impressed. You make a ton of videos. You seem to drop a new video almost every single day.
Well, I sort of like, my kids are grown up. My regular job's kind of boring. I'm just going through the motions. And so I like making the videos. I sort of feel like, I guess that's, what the heck else am I going to do, So I like doing it. I find it kind of fun. So I just sort of crank them out. I wish I could work in teleradiology, but there's almost no money in it, and I'm a terrible businessman. I'm just sort of a nerdy scholar. So I figure, well, it makes me happy to do it. I somehow get a sense of I'm doing something good, and it just makes me happy doing it. So I just keep doing it. And so that's how I ended up down this path.
Awesome. So if we can summarize, we covered a lot of different components of autoimmune disease, but if you were to quickly summarize, what is autoimmune disease and how can you prevent and treat it?
Yeah, your best bet is like what we talked about. Eat low fat, low sodium, 100% vegan diet, 100% organic, whole foods only, single ingredient only, no alcohol, no cooking oils, none whatsoever, and definitely filter your water.
Awesome. Dr. Rogers, thank you so much for your expertise and for coming back on this podcast, and look forward to doing this again soon.
Yeah, well, thank you. My pleasure.
Peace and plants.